Yeah. I will have 2 timer. I make it 6 for timer, and also I make another timer for 10 minutes. You should also have your own timer so that you are aware of the timing. Okay, and when I ask you to stop, you need to stop, yeah? So you can set 2 timer as well, 6 minutes as well as 10 minutes. Kalau 10 minutes tu, I will stop you straight away. Okay, Kamalia, ready?
Okay, madam, wait. I need to set timer.
Okay.
Okay, madam.
Okay,
Alright.
sekejap.
A very good day.
Okay, so 10 minutes maximum, starting from now.
Okay. A very good day to my respected lecturer, Madam Nur Sharina binti Zaraini, and my dear friends. Today, I'm Wanu Kamalia Ashura binti Wan Ahmad Syahid and my pair, Nurul Hazwani binti Latif. It is a pleasure today to be here to share critical insights into one of the most pressing health issues, which is chronic kidney disease or CKD. As we delve into the data, we will explore how CKD prevalence fluctuates across different age groups between genders, also helping us understand which population are most vulnerable. Now, before we dive into the data, let's first understand what CKD really is. So, chronic kidney disease is not just about kidney failing suddenly. It is a gradual progressive condition where the kidneys lose their ability to function effectively. Okay, Hazwani, moving on to the next slide. Okay, so the kidneys also we know are vital for filtering waste, balancing fluid and electrolytes, and also helping maintain blood pressure. When they are compromised, it disrupts the entire internal system. Next slide. And alarmingly, in Malaysia alone, according to a research, it is reported over 50,000 individuals have received dialysis since 2023 due to end-stage CKD. Okay, now let's look at the bar chart in the slide. Okay, so this data extracted from ResearchGate 2018 highlights the percentage distribution of CKD patients based on the 3 main age group, which are 20 to 40 years old, 41 to 60 years old, and 41 to 60 years old and 61 to 80 years old. It is also differentiates the data by gender, which pink represents males and brown color representing females. Starting with the 20 to 40 years old category, male accounts for 25%, while females are slightly higher at 32%. This indicates that in younger adults, females show marginally higher CKD prevalence. Also, in 41 to 60 years old group, which we can consider as middle age group, middle age adult, both males and females hit 57%, the peak of this data set. This is clearly that state that the most effective age group, possibly due to lifestyle factors, comorbidities like hypertension, diabetes, or late diagnosis. Meanwhile, in the line of 61 to 80 years old range, there is a noticeable decline. Males are at 18% and females are at 11%. This drop could be due to mortality, early intervention, or underdiagnosis in older individuals. To summarize, the 41 to 60 years old group exhibits the highest prevalence of CKD among both genders. This underscores the importance of early screening and lifestyle interventions, especially for middle-aged group. With that, I will now pass the presentation to Hazwani, who will be discussing the risk factor contributing to chronic kidney disease.
Okay, thank you, Kamalia. Okay, as we can see on the slide, it shows a graph from Scientific Research 2018 about main risk factor for chronic kidney disease as known as CKD, with different genders, which you can see the bar chart, the green bar represent total percentage of the main risk factor, and the blue line represent males, and the red line represent females. Okay, in the graph, in the graph just now, we see there's 6 main risk factor, which is first one is obesity, non-steroidal anti-inflammatory drugs, also known as NSAID, diabetes mellitus, DM, hypertension, hereditary, and also lastly, family history. Okay, let's look back at the graph. Okay, from the graph, we can interpret that the result, mostly the results, each main risk factor of CKD between males and females show that males are higher than females, except 2 risk factor, which is hereditary and NSAID. Okay, because as we can see, the red line, which represent females, is higher than blue line. Okay, and then we also can see the total percentage, the green bar for obesity is the highest, which is 90%, and it automatically represent the most main risk factor for chronic kidney disease. And then the least factor for chronic kidney disease is family history, which you can see the total percentage is 31%. And other than the two, which the first one is diabetes mellitus, the total percentage is 62%. Then hypertension also have the same amount of total percentage with diabetes mellitus, which is 62%, which the third highest for risk factor. And then the third green bar, which is hereditary, the total percentage is 52%, which we can conclude that hereditary is the fourth most main risk factor. And then for obesity is the first one we talked earlier, and then NSAID is the second most main risk factor, which the total percentage is 82%. Okay, and then we have done talk about the graph. Then we go next is conclusion. Okay, for the conclusion as a whole, from these two graphs, we can see that CKD is a very severe non-communicable disease and also a common disease among us nowadays. So, as a responsible person, we need to practice a healthy lifestyle to reduce the risk of getting CKD, especially for people who are in middle age, because just now my partner said middle age is the most age that is getting CKD. And then, moreover, at school or universities, teacher or any association can provide an early education or awareness to students about CKD to prevent that regarding the prevention of getting CKD later on. And then health authorities such as hospital or government clinic can organize a health screening once a year to every individual, especially middle age or older age or even younger age, for early diagnosis that can prevent some disease, especially CKD that we talk about, from progressing more severe stage. So I think that's all from us. Thank you.
All right, thank you very much, pair 3. Next, pair 4, please.
Thank you, madam.
Thank you. Nurul Aklima and Sharifah Nur Adillah, please switch on your camera.